I have symptoms and I want to get tested before I go into my office.
From free city and state supplemented COVID-19 testing.
My kids bring home the COVID test kits from school.
To testing tents that promise to bill your insurance provider.
I know that PCR, I think, costs money now, but rapids are free.
The testing landscape is changing.
I am less likely to do it if it costs a lot of money.
We could soon be dealing with something similar for vaccines, which up until now have been free to the public. But the deals the federal government struck with companies like Pfizer and Moderna are set to expire. Pfizer says their vaccine could cost up to $130 per dose. Dr. Carl Mingus, chair of Population Health and Leadership at the University of New Haven, says the pivot to the private market at this phase in the pandemic is not entirely unexpected.
This is just sort of a natural progression of what we would have expected, right? To get a handle on the pandemic, to have vaccines widely available, to have boosters now available and widely available, and then to switch to a commercial market. There are, of course, downsides to that as well.
Especially for low-income, underinsured, and uninsured Americans. While private and public insurance is expected to cover most of the cost by law, for everyone else it will not be as straightforward. Pfizer says it has a program to help those with no insurance get shots, and individual cities and states could continue to pay for vaccines directly. Mingus says the support programs will continue to be needed for those most in need.
And those are also the individuals who are less likely to get the vaccines in the first place, but have reaped the greatest rewards of having access to the vaccines and testing. So we do have to keep an eye on the equitability equation